Betta-Health presents Vitamin B12 Deficiency 12 Signs You Should Never Ignore. Do you get enough vitamin B12? Do you know the daily intake of vitamin B12? Do you know if you are getting the required dosage daily? You'll want to make sure that you do, in order to stay healthy. Vitamin B12 is vital for optimal health and well-being. It does a lot of things for your body. For example, it helps make your DNA and your red blood cells. Because your body doesn't make vitamin B12, you have to get it from animal-based foods or from supplements. You should do that on a regular basis, because your body doesn't store vitamin B12 for a long period of time. How much vitamin B12 should you take daily? The answer depends on things including your age, your eating habits, medical conditions, and what medications you take. All things being equal, a healthy adult must consume at least 2.4 micrograms of B12 daily. You can get vitamin B12 in animal foods, which have it naturally, or from items that have been fortified with it. Animal sources include dairy products, eggs, fish, meat, and poultry. But, many persons do not consume enough B12-rich food or supplements. In addition, quite a number of people are unable to absorb enough B12, no matter how much they consume. Consequently, many people develop B12 deficiencies, and it is a possibility you might be one of them. Also, as you age, you become more and more susceptible to vitamin deficiencies. Research has shown that 20% of people over 50 have low levels of vitamin B12. But most people overlook the signs, because the symptoms are varied, and common among other conditions as well. To prevent or reduce the incidence of vitamin B12 deficiency, here are 12 signs of vitamin B12 deficiency you should never ignore. Number 1. Weakness and fatigue. Weakness and fatigue are very common symptoms of vitamin B12 deficiency. They occur because your body doesn't have enough vitamin B12 to make red blood cells, which transport oxygen throughout your body. As a result, you are unable to efficiently transport oxygen to your body's cells, making you feel tired and weak. In the elderly, this type of anemia is often caused by an autoimmune condition known as pernicious anemia. People with pernicious anemia don't produce enough of an important protein called intrinsic factor. Intrinsic factor is essential for preventing a B12 deficiency, as it binds with vitamin B12 in your gut so that you are able to absorb it. Number 2. Changes in the mood. People with B12 deficiency often report changes in mood. In fact, low levels of B12 have been linked to mood and brain disorders like depression and dementia. The homocysteine hypothesis of depression has been suggested as a potential explanation for this link. This theory claims that high levels of homocysteine brought about by low levels of B12 could cause damage to the brain tissue, and interfere with signals to and from your brain, leading to mood changes. Some studies suggest that in certain people who are deficient in B12, supplementing with the vitamin can reverse symptoms. It's important to note that changes to mood and conditions like dementia and depression can have a variety of causes. Thus, the effects of supplementing in these conditions remain unclear. If you have a deficiency, taking a supplement may help improve your mood. However, it's not a substitute for other proven medical therapies in the treatment of depression or dementia. Number 3. Dizziness and breathlessness. Dizziness and breathlessness are also symptoms of a vitamin B12 deficiency. These signs happen frequently, especially when there is a sudden change in your posture, like standing up after sitting or lying down, or immediately after strenuous physical activity. Let me repeat, this happens because the body is short of red blood cells. When there is insufficient oxygen, the cells in your body cannot perform their functions effectively. Number 4. Sensation of pins, needles, and numbness. The destruction of the nerve is the most serious side effect of B12 deficiencies. A chronic lack of B12 causes reduced production of myelin, which makes up the protective sheath around the nerves. When the nerve becomes weak and exposed, the body may experience abnormal sensations, which is a pins and needle sensation throughout the arms, hands, legs, or feet. A lack of feeling in the limbs that fall asleep is also common. These symptoms of vitamin B12 deficiency typically occur in conjunction with anemia. Number 5. Changes to mobility. If a vitamin B12 deficiency is not treated, the nerve damage may continue to a point where it affects your balance and coordination. This symptom is most common in the elderly, and it raises concerns about accidents such as falling. This symptom is often seen in undiagnosed B12 deficiency in the elderly, as people over the age of 60 are more prone to a B12 deficiency. However, these symptoms may also be seen in young people, but preventing or treating deficiencies in this group may improve mobility. Number 6. Paleness or jaundiced skin. People with a B12 deficiency often look pale or have a slight yellow tinge to the skin, and whites of the eyes, a condition known as jaundice. This happens when a lack of B12 causes problems with your body's red blood cell production. Vitamin B12 plays an essential role in the production of the DNA needed to make red blood cells. Without it, the instructions for building the cells are incomplete, and cells are unable to divide. This causes a type of anemia called megaloblastic anemia, in which the red blood cells produced in your bone marrow are large and fragile. These red blood cells are too large to pass out of your bone marrow and into your circulation. Therefore, you don't have as many red blood cells circulating around your body, and your skin can appear pale in color. The fragility of these cells also means that many of them break down, causing an excess of bilirubin. Bilirubin is a slightly red or brown-colored substance, which is produced by the liver when it breaks down old blood cells. Large amounts of bilirubin are what give your skin and eyes a yellow tinge. Number 7. Disturbed vision. If you have a B12 deficiency, you might also experience blurry or distorted vision. This symptom is more common when the deficiency progresses into nerve damage. Once it affects the optic nerve, which is responsible for connecting the eyes to the brain, signals cannot travel effectively, and disturbed vision occurs. Although some overlook vision deterioration as a part of life, it may be the result of a preventable vitamin B12 deficiency. Number 8. Skin, hair, and nail problems. Vitamin B12 is also essential for healthy skin, hair, and nails, and if your B12 intake is low, you might notice their decline. One possible symptom is vitiligo, a pigmentation disorder that causes white patches on the skin. Other skin issues include acne, dermatitis, hyperpigmentation, and skin lesions. Low levels of B12 can also cause hair loss, prematurely gray hair, and brown-gray nails. Number 9. Glossitis and ulcers of the mouth. Glossitis is an early sign of a vitamin B12 deficiency, and it causes inflammation of the tongue. You may notice lesions, redness, swelling, or pain. Once your tongue changes its shape and color, you may struggle to speak and eat. In addition to these unpleasant symptoms, a vitamin B12 deficiency can also cause other oral issues, such as mouth ulcers, pins and needles in the tongue, and a burning or itching sensation around the mouth. Number 10. Digestive issues and a decreased appetite. Low levels of B12 can also be linked to problems in the digestive tract. Symptoms include nausea, vomiting, heartburn, abdominal bloating, gas, constipation, and diarrhea. With an upset stomach or recurring diarrhea, you might feel weak and lose your appetite. In the long run, this could lead to unhealthy weight loss. When you talk to an experienced physician, they may be able to notice symptoms of a vitamin B12 deficiency straight away, however, you'll need a blood test to confirm it accurately. Number 11. Mental problems. This includes difficulty in thinking and memory loss. Since vitamin B12 is responsible for the formation and development of brain cells, when it is less supply in the body, then the brain deteriorates in its functions. Number 12. Hallucinations and paranoia. This is rampant in old age people, especially above 60 years. This is due to the decrease in neurotic functions without any boost by the vitamin B12. Vitamin B12 also helps by increasing use of folic acid, which increases brain health and increases memory. Treatment. If you have pernicious anemia or have trouble absorbing vitamin B12, you'll need shots of this vitamin at first. You may need to keep getting these shots, take high doses of a supplement by mouth, or get it nasally after that. If you don't eat animal products, you have options. You can change your diet to include vitamin B12 fortified grains, a supplement or B12 injections, or a high-dose oral vitamin B12 if you are deficient. Older adults who have a vitamin B12 deficiency will likely have to take a daily B12 supplement, or a multivitamin that contains B12. For most people, treatment resolves the problem. But, any nerve damage that happened due to the deficiency could be permanent. Prevention. Most people can prevent vitamin B12 deficiency by eating enough meat, poultry, seafood, dairy products, and eggs. If you don't eat animal products, or you have a medical condition that limits how well your body absorbs nutrients, you can take vitamin B12 in a multivitamin or other supplement in foods fortified with vitamin B12. If you choose to take vitamin B12 supplements, let your doctor know, so they can tell you how much you need, or make sure they won't affect any medicines you're taking. Have you ever had a vitamin B12 deficiency? Do you know anyone who has this deficiency? How did you discover the problem? What action did you take to remedy or manage the condition? Let us know in the comments section below. If you enjoyed this video and found it useful, give us a thumbs up, and like, share it with your friends, and comment so we keep the engagement going. Don't forget to subscribe so you won't miss any of our future videos.